Welcome students, we're going to be talking about diet and renal disease. So we finished up last week doing some cardiac stuff, going on to kidneys now, and next one we'll be doing here real soon will be the GI alterations. So today we're going to review the basic functions of the kidneys. I need to go over with you and explain how they work a little bit so you can understand the nutrition considerations. If you've had any previous anatomy physiology classes, you have a little background of this information. But since that's not a requirement for this class, I do want to just review it basically for those that may not have that knowledge. Some pretty amazing stuff. We're going to list some goals of nutritional care of kidney failure. Kidney failure and nutritional considerations tend to get very, very complex. We're going to go over some key things related to that and to discuss the nutrients commonly modified in the dietary treatment of kidney disease. We're going to do spotlight on a few important nutrients. Some surprising stats. 1 in 3 American adults are currently at risk for developing kidney disease. And for this lecture, I also put together a handout that I'll be giving you that has some good information on it too. 26 million American adults have kidney disease, and most don't even know it. Kidney disease is the 9th leading cause of death in the United States. Because it often has no symptoms, it can go undetected for many years and is also known as like a silent killer. Black Americans specifically, 3 times more likely to experience kidney failure. Every 30 minutes, your kidneys are so incredible they can filter all the blood in your body, removing waste and excess fluid. Unfortunately, 120,000 Americans are currently on the waiting list for a life-saving organ transplant, and fewer than 17,000 people receive one each year. Every day, 12 people die waiting for a kidney. And the people that are on the need for a kidney transplant list are those that are on end-stage renal disease. As the stage 5 final stage, the kidneys are no longer functioning and they're reliant on dialysis. And we're going to talk about dialysis a little later. Now, I wanted to show you guys, and I would do this a little more interactively if we were in class, but I wanted to at least show you from the National Kidney Foundation. There was this, let me get it up. Welcome to the kidney. It's kind of like what we did with the diabetes one, and I wanted to show you a little bit, just for fun. How many kidneys do most people have? What do you think? 2, 3, 4? It's about 2. Hopefully most of you know this. You know, surprisingly enough, we're all born with 2 kidneys, but we actually only need 1. That 1 kidney can do the job, do the filtering, removing of the waste products, everything just fine. And we'll go over the functions of the kidneys today. So you hear of kidney people that are donating their kidney. They have 2 healthy kidneys. They can actually donate the 1 and be just fine. How big are your kidneys? The size of your head, the size of your fist, the size of your eye. And I'm going to go with right in the middle, the size of your fist. So if you put your fists together right now, that's about the size that they are. And they're on your back. You know, if anybody had an injury or they got kicked really hard in the back, that's kind of where you're most vulnerable for them, right underneath kind of your rib cage back there. If you've ever had kidney stones or kidney infection, you'd feel that. You actually call it flank pain right there on the bottom. I have some images a little later you can see where your kidneys, oh, look at that. In your back, just below your rib cage, in your back behind your lungs, or by your belly button. Is it by your belly button? No, I was wrong. Your kidneys are located on either side of your spine at the lowest level of your rib cage. So if you reached in your back and kind of felt where they are, felt in the front of your rib cage, well, they're kind of right in there. And it gives them some protection for injury, except, you know, God provided our rib cage for protection for our internal organs. They can be damaged in trauma. Which of the following are main functions of your kidneys? It is all of the above. To clean the blood, to support healthy bones and tissues and to keep your blood pressure normal. So it's an incredible role that your kidneys play. And we'll talk about that water balance, blood pressure control. A lot of you didn't know that your kidneys play such a role in blood pressure management. And we'll talk about that today. Who can get kidney disease? Anyone at any age. Kidney disease in children and teens is most often due to birth defects, genetic conditions, and as you get older, more commonly it's blood pressure, diabetes, inflammatory processes, but anyone can be affected. What happens if your kidneys stop working? You go on dialysis, you need a kidney transplant, nothing? Either the first or the second option. That's right, it's either the first or the second option. Before dialysis was available, stage 5, end-stage renal disease, total kidney failure meant death. When they stop working, really toxins are just allowed to build up in your body. And if you don't get dialysis, which dialysis really just is your kidneys in way of a machine, you would die if you didn't get a transplant or dialysis. What can you do to keep your kidneys healthy? These are things for you guys to think about with your healthy kidneys. It's all of the above. Don't overuse over-the-counter painkillers. We'll talk about how our kidneys filter things, even like medicine. So overdoing something like that can hurt. Watch your blood pressure. High blood pressure is a very common reason for renal disease. Eat healthy and exercise. Helps us keep the blood pressure and weight control. Good. You're at risk for kidney disease if you have, and it is all of the above here, diabetes, family history, high blood pressure. Couple more. Every day our kidneys perform an essential job of filtering how many liters of blood? 10, 50, 200? And think about that. Liters of blood. It's crazy. It's 200. That's enough, if you want to visualize this, enough to fill a large bathtub. Wow. You know, just removing toxins and filtering waste every day. How many adults in the U.S. have chronic kidney disease? I'm just going to do a random click. Is it a, nope. It is, wow, it's the high one right there. 26 million people are suffering from chronic kidney disease. And this has kind of done the same upward trend as cardiovascular disease, as diabetes. And unfortunately, most people don't even know it. It's kind of like the pre-diabetics and the diabetics that don't know it, often getting kidney disease and not knowing it too. All right, and that concludes the quiz. I think we did pretty good, and hopefully you saw some points in that come out. You know, one other thing I was going to show you, but the sound will not work on here, is if you go to the YouTube, this is a good, I really like the visualness in this video, and I'll just mute it and kind of show you. It just really goes over some really good images of how the kidneys are made in the lobes, and then the filtering agents here, glomerulus, it really goes through it. And you know, I like videos. It's called Human Kidney. It's an amazing machine inside. But we'll continue on with the PowerPoint here, and you can see, yep, make sure my time's still running. Okay. All right, so let's talk about your kidneys and how they work. Oh, we got some good, that's a good image right there, showing how your two kidneys are sitting. And make note of all that rich blood supply that's going right to the kidneys. Real important that our kidneys are perfused really well with oxygen to keep them working appropriately. All right, so the first thing, I want to talk about 3 specific things that they do. First thing is the filtration. The kidneys remove waste and extra water from the blood to form urine. Urine flows from the kidneys to the bladder through the ureters, actually, and you can see right here that ureter coming off the kidney. That'll go to the bladder. Then from the bladder, it actually is called the urethra, where urine is excreted. So filtering, it's like they're sophisticated trash collectors. And you know, like that quiz reviewed, every day your kidneys will actually filter like 200 liters every single day. and that waste and extra water become urine and will be excreted. And you're like, where does the waste come from? What are these wastes I'm talking about? Well, they actually come from the normal breakdown of even your muscle when you're using muscle, and from some of the food you eat, and from even like medication breakdown. So your body will use food for energy and self-repair. But after your body has taken what it needs from food, some waste is sent, is in the blood. And if your kidneys did not remove some of these wastes, the waste would just continually build up in your blood and really damage your body like a toxin. And actually, the filtering comes from these tiny units that you'll see from the picture on your screen, these nephrons. Every kidney has about 1 million nephrons, and in the nephron, these tiny blood vessels called capillaries intertwine with these tubes called tubules, and there's a complicated chemical exchange that takes place right here. And when you go on to take excuse me just a moment, when you go on to take your physiology class, you'll really learn much, much more about these nephron filtration and so forth. It's really, really amazing. But 99% of everything filtered will actually leave the body. So it's an exceptionally good filter in its way that it does it. And, I mentioned before waste being from muscle. And remember how we learned about that macronutrient protein. What did protein have in it that was different from carbs and fats was that nitrogen. So when that nitrogen gets broken down in the muscle, that's one of the waste products that needs excreted. What do they do? Another thing, reabsorption. Now, what is reabsorption? We said filtering, and filtering was about going through the waste. Reabsorption is actually, the definition is an active transport which takes the useful substances for the body from the tubules and places them back into the blood-filled capillaries. So this is when useful things that our body so needs, that our kidneys have a great gauge to know what we need. Some examples right here: sodium chloride, water, sodium, glucose, some vitamins. Your kidneys are actually in charge of knowing what our body needs. And some things will actually get reabsorbed right back into our blood system as, going through those filters. They're taking a look at it, but there's some things that we need. And this is happening within that nephron system too. And it's just bringing those useful substances back. And there's a movement of these molecules going from a lower concentration to a higher concentration. Now, it's kind of like what I did with the cardiovascular and diabetes. This physiology and anatomy process of you're learning right now is just to help you understand the nutrition. I want you to know this, but for testing purposes, I am just going to focus on the nutrition. But it's good for you to know this stuff to really understand why the nutrition is important. So, again, think of it as the kidneys is helping with the balance of these electrolytes, and also real important for blood pressure. Because that sodium, we learned about sodium in the fluid volume. That kidney is going to be able to say, hey, we need our blood pressure increased. It'll retain some sodium, and that's going to pull in some water, causing blood pressure to rise. And so the kidneys are able to measure out chemicals like sodium, phosphorus, potassium, and really regulate it. The right balance is necessary for life because excess levels can be harmful as well. So there's just the right amount that it needs. Next thing, what do? Excretion. And excretion part is the removal from the body of the waste products. So this is where it goes from the kidneys. There's a great image: ureter, bladder, urethra, excretion. So we're removing the metabolic waste. It also plays a role in, interestingly enough, acid-base balance with considerations to hydrogen. Just an FYI, you'll learn much more about that in the future. Really important base called bicarbonate that the kidneys can regulate. Kidneys are amazing when there's a trauma situation or a person's ill and your kidneys needs to respond to, say, a trauma of blood loss, that they will try their best to try and conserve sodium, conserve water, keep fluid in, try and make sure things are doing well. Another thing that's important, and I often see this just being in the ICU, is patient coming in with, we went over cardiovascular disease the other day, but a really bad heart attack. And then oftentimes when someone has a really bad heart attack, because your heart is a muscle, it gets bruised and it doesn't work kind of as a pump good for a while until that bruising heals, and the heart pump can actually affect blood getting to the kidneys and the kidneys working. So someone even after a heart attack, we're able to monitor their kidney function by method of using blood work to see if their kidneys are still getting perfused and working good and still able to do those valuable jobs that it does. Okay, and I just put together some just examples of pulling this together. You see my bag of chips and my medicine there. Uh, Alright, so let's say you decide to eat several bags of salty potato chips in one sitting. Maybe you did that recently, or, one of those little baggies, a few of those, or you had a big bag of potato chips and you just kept going at it. Well, the sodium is absorbed into your body by your intestines, during that digestive and absorption process we learned about. This will, excuse me, increase the concentration of sodium in your blood. And this increased sodium in the blood will be filtered by that nephron we looked at. And while the sodium transporters will attempt to reabsorb some of the filtered sodium, it is likely that the amount will exceed their ability because there's so much sodium. And a lot of that excess sodium will remain right there in the kidney, and water will also remain because water follows salt. So the excess sodium will be excreted into the urine and eliminated from the body. But sometimes when you have, so much of a electrolyte like sodium coming in at that amount, that you get that water retention, even though your body's trying to pull a lot of that salt out because your kidney knows, we don't need a lot of that excess salt right now. That's going to cause an increase in blood pressure. So your kidneys is trying to excrete a lot of that sodium. But still, with that amount coming in at once, it might exceed the kidney's ability and cause you to have some excess sodium in your body, excess water, and then an increase in even blood pressure. So just an example of how something so simple like that can affect it. We've talked about how salt is important to keep down because of blood pressure. We've talked about how water follows salt. But here is that water follows salt on the most the most basic level right now at the kidneys. We got excess salt, we got excess water because your kidneys is maybe not able to excrete all that sodium, and that water is following the sodium. And another example can be medication. We've all gotten headaches from time to time, gotten ill, and maybe you're taking Tylenol, Motrin. I'll focus more on Motrin. Motrin, the same thing as Advil, ibuprofen. Because the thing specific about those are in the classification of NSAIDs. They're NSAIDs. It stands for non-steroidal anti-inflammatory drugs. And those types of medications are metabolized very much so in the kidneys. Where Tylenol, on the other hand, is metabolized more so in the liver, for example. All drugs have a component of the kidneys are going to do something for it, but some medications have more harm than others for the kidneys specifically. And one of those examples is Motrin. And even from that quiz, when I said some lifestyle habits that you can do is, watching those over-the-counter things, but especially Motrin. because over time, if you're taking a lot of consistent dosages of them, that can put your kidneys having to work a lot harder. And I had a stat here at some point in my paper, but it was like, I'll get it later when I get to dialysis, but it has to do with how many people that are on dialysis are there because of the medication NSAIDs, and it's a lot. So you take a medication, and it also gets absorbed into the intestines, into the blood system. That medicine acts on target cells, and but then it also is going to end up getting filtered by the kidneys when it's done doing its job. And most medicines aren't able to get reabsorbed back into the body. That's why we need to take repeated doses. Medicine's only going to last 4 to 6 hours maybe. And we have to take repeated doses. That's because it gets filtered out of our body. And we excrete via urination those waste products. Just a couple examples of things you can think about. Pardon me. So, a few things on why they fail. 3 common conditions that increase the risk of renal disease. And this is why I want you to really feel it. Okay, obesity. We have talked about that. Another correlating disease for obesity. Poorly controlled diabetes. I told you that was coming up. And hypertension. HTN is an abbreviation for hypertension, also known as high blood pressure. And, I mentioned earlier, young people, there are things where they can get birth defects, where their kidneys don't function well, or some inflammatory, polycystic, genetic thing with their kidneys where it doesn't really work well. There can be lots of reasons why your kidneys fail. These are actually the 3 most common reasons why they do fail. And most kidney diseases are working right there on that nephron, causing them to lose their filtering capacity. And damage to the nephrons may happen quickly. Maybe it was a drug overdose, a poisoning, something like that. But maybe it's happened slowly. Maybe it's that diabetic who's slowly not been managing their glucose levels, and that sugar has just been damaging those nephrons on that basic vascular level, and maybe take years to do. The problem with high blood pressure, it damages those small blood vessels in the kidneys. The damaged vessels cannot filter the poisons from your body. And your doctor, if diet and exercise hasn't been working, and at this point they're causing renal problems, they're most likely going to get on some blood pressure medication that actually will help protect the kidneys and help. And how does the doctor know how the kidneys is failing? Well, we're actually able to do blood tests that can show. And the blood tests, you don't need to remember this. You'll hear it again someday. But it can measure the creatinine excretion. And the creatinine excretion is based on that skeletal muscle breakdown. And when that is going up, it can actually measure the filtering ability, getting worse. Let me see, look here. Yeah, if you've ever heard of polycystic kidney disease, it's pretty awful. It's a genetic disorder where a lot of cysts even grow in the kidneys. And it really just, these cysts grow and grow and grow. Children seem to get these. They can even see these developing in the womb sometime. And it's a really, really sad one. Now often they need transplants or dialysis. And some other reasons I put on here: trauma, infections. I mentioned just that birth defect. I've kind of led on to some medication, toxic metal consumption. So there's some other reasons. Really want you to understand those top 3 ones really well, though. All right, so what is renal function? And this is, your healthcare team might talk about the work your kidneys do. And if you have 2 healthy kidneys, you have 100% renal function. This is more than you even need. Some people are born with only 1 kidney and they can lead normal, healthy lives. Some people donor one of their kidneys and can lead healthy lives. You can actually be healthy with 50% of your renal function. as long as that 50% remains stable and remains working well. But many people that only have 50% of their renal function have kidney disease that'll probably progressively get worse. And you'll really get into some serious health problems if you get less than 20% of your renal function. And if your renal function drops below 10-15%, you really can't live long without some form of dialysis or transplantation. Alright, so an assessment of renal function might be required to identify renal impairment, to monitor a disease progress, to assess baseline measurements before starting medication. So some medications we know that they may damage the kidneys. So the doctor will order a patient to get a baseline kidney testing and then maybe follow up in 3 to 6 months and then just kind of have follow-ups. You know, if this is a patient that is known to have high blood pressure with a degree of renal function, they're going to get some routine lab testing to just measure it. And the most frequent test that we can use to actually measure is the glomerular filtration rate. It's called the GFR, glomerular filtration rate. It'll actually is a measurement based on determining how good those little glomeruli in the kidneys are filtering during the passage through the kidneys. So it actually just measures how well it's filtering. Glomerular filtration rate. I will not test you on that, but it's kind of interesting to know. And so I gave you some examples of, acute versus chronic renal function, toxic poisoning versus, a diabetic that is living with this chronic. Acute, think of it as a sudden illness, and chronic is more of an illness that's gone on for 3 months or more. And staging examples is kind of interesting. I talked with you about like the 100%, so forth. Let me show you this example. I got this off of a website, but I thought it was pretty cool. So the stages of chronic kidney disease are mainly based on that GFR I mentioned to you. There's 5 stages, but normal's considered about stage 1 anyway. And let's just look those over with me. Stage 1, you have a glomerular filter rate that's 90% or better. Normal kidney function, but maybe at this point, if they're designated as a stage 1, their GFR is still good, but they're finding something in their blood work. They're probably seeing some microalbumin, which would be some small amounts of protein in their urine, and that can actually show that there's some structural maybe abnormalities. Maybe it's a genetic thing. Further testing probably needs done at that point. They really observe and control blood pressure, because we know blood pressure can highly impact the function of the kidneys. And we want to keep, if someone's going to be at stage 1, we don't want them to progress. That is the goal of this. The job of the kidneys cannot be replaced by anything else. And I told you how many people are waiting for kidney transplants right now. And I'm going to talk about dialysis here real soon, and it's not something fun. Stage 2 is where your GFR is running about 60 to 89, but there's mildly reduced kidney function, and there's might be other findings that are pointing to kidney disease. Observe, control blood pressure, get risk factors under control, especially the modifiable ones, the one that they can change. And then you can see when we get to that stage 3, moderately reduced kidney function at this point, and for severe, when we get to stage 5, that's when we have less than 15% function for filtration. We need dialysis or we need a kidney transplant. That is what end-stage kidney failure is. And if you have someone in your family end-stage kidney failure, I'm sorry to hear that, because this is something that's just so hard on a patient to go through. What dialysis is. is needed for that person in stage 5. There are 430,000 Americans on dialysis. And if you ever want to go on into a specialty for nursing, you can get trained to be a nurse. And they actually do this type of thing all the time, dialysis. And if you looked at a map, if I showed you a map of the U.S. where the condensed amount of dialysis patients are, it's in those southern states again, but a lot in Ohio, a lot right here. Okay, sorry if I pause, I am coughing. So when your kidneys fail, dialysis is what keeps your body in balance by doing what your kidneys do, removing the waste, salt, extra water, preventing those toxins to build up in your body, and keeping a safe level of those chemicals in your body. And kidney failure, if you ask yourself, is it permanent? It's like usually, but not always. Some kinds of, if it's an acute kidney failure, might be able to get better, depending on the cause and with the treatment. But if this is someone that has progressively gone down the list and a chronic disease went down all those stages, you most likely, this is your lifestyle the rest of your life, getting dialysis. Dialysis can be done in a hospital, a dialysis center, or even at home if you're on a special kind of dialysis. But this type of dialysis, you're looking at my picture, is an example of hemodialysis, where they're actually getting right into your blood system. And this is usually done about 3 to 4 times a week. It usually takes about 3 hours. And what they do is they make an access site in your body. They actually use your own artery and vein, and blood comes out. Blood gets filtered by that machine, and a solution called a dialysate solution, it does that job of the kidney, and it puts the blood back into the body. So it pulls all that waste and extra fluid and right back into the body after it's cleaned. And so it doesn't allow that toxic buildup in their body. And they have to do it so frequently because the kidneys are doing about nothing right now. They have failed, and they are not doing an adequate job. Just another type of example of dialysis. There's another kind out there, just for your FYI information. It's called peritoneal dialysis, where they actually are able to the peritoneum is a cavity that lines the abdomen. We all have a peritoneum. It keeps the cavity of your intestines and your internal organs covered and lined through your intestines. And so what it does is there's an access site through your abdomen, and dialysate solution will actually go into the peritoneal cavity that'll sit, and this fluid will sit on the outside of your intestines. And the dialysate solution is actually so incredible that it can pull out the toxins from your intestines into where the dialysate solution is sitting in your abdominal cavity. And the catheter that was going in the patient puts in the dialysate solution, and then when it's time to drain, depending on their system, but it's usually kind of in there for a few hours, and they'll actually drain it right out. And this is a more, patients can keep more of an active lifestyle with this type of dialysis, but it's very unique. So, pretty cool. But some things that we want to talk about specifically now, nutritional considerations for this patient. And like I said earlier, they do get very complex. And I'm going to be saying this a lot. The textbook says it's 2, you can check. But the nutritional needs are like constantly changing. There is not going to be one single diet. I'm not going to be able to say every person with kidney failure needs this exact type of diet, because it's really going to make a difference when the doctor looks at their blood test and how specific their kidneys are filtering at that time. So they're constantly changing. So they need constant assessment, monitoring, treatment, education, There's challenges to these patients. A lot of times they don't feel like eating. They have anorexia, no interest in food, nausea, vomiting, and that's related to this uremia in their body, which builds up as a result of renal failure, often called urea that's in the blood, uremia. It's one of the primary components of urine, and it can be defined as an excess of amino acid and protein metabolism, such as like that nitrogen. And it's normally excreted in the urine, but now it's building up in the blood. And this just makes people feel so sick. It's like what they can't urinate out and excrete as a toxin builds up in their body. So often they're dealing with anorexia, nausea, vomiting. Malnutrition is so common for patients with a more advanced degree of renal failure, more like stage 3, 4, and 5, I would say. 34% of clients that are on hemodialysis are even moderately to severely malnourished. Very, very much so. And you got to think about it, that there's increased catabolism, a lot of breakdown, and decreased food intake a lot of times. So they even think about doing approaches such as, we've learned about nutrient delivery, oral supplements, tube feedings. We talked about the peg tube. If this is something where they just, they're dealing with nothing sounds good, terrible appetite, and they can't eat enough to get their calories and they are wasting away, they might do one of those peg tubes, that feeding tube that gets inserted into their stomach to deliver some extra nutrients that way. Or they might do IV feedings for a little bit if they're in the hospital. The goals of their therapy are to attain and maintain the most proper nutritional status that they can get for their individual needs at that time. Prevent protein malnutrition. Protein malnutrition is a big deal with renal failure patients, because what happens is because of the protein that's breaking down that your kidneys can't excrete, a lot of these people end up being on a low protein diet, and we get protein malnutrition. Minimize uremic toxicity. That's what I mentioned before with the urea. That's urea. It's urea that's in the blood. And urea is a component of the breakdown of the amino acids from the protein. Urea should be excreted via urine. We don't want uremic toxicity, but oftentimes in those end stages. In that stage 5 patient that needs dialysis to clean their blood, if they didn't have that dialysis, they would have uremic toxicity so bad they would die. Maintain adequate hydration status. Remembering how kidneys, not only are they, deciding sodium, potassium, phosphorus balance, all that stuff, they're also helping our fluid and water balance. If our kidneys aren't working really well, we often see people getting edematous. There might be some good pictures in your textbook for this. Retaining a lot of fluid. It was many weeks ago that I talked with you and I said, what's the best indicator of, fluid retention? And that's measuring someone's weight. So even watching their weights will help us see their fluid balance. And modifying their diet for their health needs, because often these patients are diabetic or have some hypertension, so maybe they're watching their cholesterol too, and maybe some even more health needs, so just modifying their diet. Postponing progression as long as possible, and progression is the advancement of those staging that we saw. So how are we going to do this? We're going to work on these common nutrients that are modified. So the need to restrict or encourage the consumption of any of these nutrients changes according to the client's medical status and treatment approach. So for example, at one time they'll need to watch their sodium, and maybe another time it's not as strict. And in practice, you'll see that some Since dialysis clients are seen regularly, topics are addressed such as, their laboratory values and their clinical condition really will indicate a need. So first thing up is just kilocalories. These people need additional kilocalories because of the catabolism that's going on in their body. And, the end products of fat and carb catabolism are just carbon dioxide and water. There's no nitrate, remember? So neither of these dietary considerations impose a burden on the client's compromised excretory ability. So having a diet with the extra calories and getting those extra calories from carbohydrates, getting those extra calories from healthy fats are a good idea because they're not going to aggravate the problem with that extra protein, extra nitrogen. And an oral supplement I put on here called Suplena is a low protein, high calorie product. So it can be used if they're unable or unwilling to consume enough food, but they also have to be willing to ingest this oral supplement, which can be hard with people that are nauseous, that are not feeling good, because an adequate number of calories is crucial to the success of their dietary treatment. And they need it to just keep going on and, living. And if they have diabetes and renal disease, need for good controlled blood sugars is even important as well. So if we're getting more calories from carbohydrates and you're thinking, well, that's sugar right there, that's true. And so they're going to have to watch their distribution of sugars throughout the day, making sure they're also managing their diabetes on top of this. It does put an extra stress into their life. I told you that renal diets are probably the hardest diets for the registered dietitians I work with to teach a patient about, because for the fact that it does kind of change and it tends to be very, very strict. A lot of patients on any degree of renal failure, exceptionally high degree of non-compliance with their diet, just because it is very, very strict. It takes a very dedicated person to follow everything well. And so just encourage them along the way. Okay, so let's talk about protein a little bit. So the primary goal of nutritional therapy is controlling nitrogen intake. And so control may mean decreasing that dietary protein, or it could mean keeping the same or even increasing, but that is going to be based on their medical needs. But in general, I would like to tell you that the protein is going to be restricted. Most generally, protein is going to be restricted. But making sure what protein we do have coming in, even if it is restricted, which it probably will be, that they are good, complete sources. And thinking about what those complete sources mean. And I saw a lot of this on the personal diet analysis, thinking about complete sources. So that you just think meat right off the bat. Remember, dairy products and eggs. Throw those in there too. But think about those. Think, for your personal diet analysis. Those complete sources that I just mentioned are great ones to do for someone that's protein restricted. The protein that they do have come in, you want it to be complete. Remember, there's incomplete sources. What are those? Those are, peanut butter, your nuts, your grains, your seeds. Those types of things are example of incomplete sources. But for the renal patient, they want to focus on complete. A vegetarian diet has been proven to be somewhat beneficial for patients with renal failure. But the problem with that is that they're high in potassium and phosphorus, so be really careful. So the goal is to eat the right amount of plant proteins while keeping the phosphorus and potassium under control.